So a lot of my work that I'm doing right now is with corporations with workplace wellness. And so one of the things that I do as part of a framework that I teach them is self-regulation. And when we talk about self-regulation, it really just involves being in the here and now. And so with a lot of us dealing with the anxiety of COVID, self-regulation is truly going to be the key to bring us back to the present. And so, what that looks like is whenever we're feeling anxious about certain things, it's especially about COVID, that can involve some deep breathing to help us kind of get that anxiety down a bit. It can involve us taking a walk and also physical activity. So, and really, when we talk about where we want to start is identifying what emotions are we experiencing right now and give those emotions some legitimacy.
Yeah, don't ignore it, right? Because it's real. How do you know, though, the difference between
Exactly.
stress and impairment? Because some people say, I can't deal with this at all. I can't move. I can't think. I can't get anything done.
Yeah. So one of the things that you want to do is stop and ask yourself, am I experiencing a real danger in the present? Or am I thinking about something that may happen in the future? So ask yourself, is there a danger here and now? Or am I safe in my house or in my workplace or in the grocery store? And so that will help us kind of decipher a bit as to, is this anxiety or is this a legitimate impending doom that I'm experiencing?
September, that's a month that so many people circled on their calendars, right? Because it meant for so many people return to work or return to some
Yeah.
kind of normalcy. That didn't happen for so many. What steps can be taken to deal with that disappointment? Some people prefer to be in that cocoon of safety, but
Yeah.
others are so disappointed.
Yeah, for some individuals, they need that social connection. And so, if it meant going back to work for you, one, acknowledge that you are grieving. And so, grieving that loss, but also trying to find other ways to make that connection. So, if your plan was to go back to work or go back to college campus, then what that means is you're going to have to shift a little bit and find ways to make connections outside of the workplace or outside of campus by meeting with friends and staying social with individuals.
You have to be proactive about it, it sounds like, is the advice. But everybody reacts
Absolutely.
differently,
Yeah.
doctor. Yeah, to the stress. The CDC says it can cause an increased use of drugs or alcohol, perhaps if you're predisposed. What are some other signs that you or perhaps a friend might not be handling this as well as you think?
Absolutely. If the stress or the anxiety is prolonged and it's sticking around, is you're not able to kind of shake it a bit, then what that means is it's probably time to reach out to help to see a psychotherapist. We really want to try to avoid that tendency to start drinking more because that is just going to make your symptoms worse. And so finding other outlets, whether that's incorporating exercise into your daily routine or checking your diet to seeing, what are some of the things that we're eating that
Mm-hmm.
is making us more tired, making us want to stay in bed all day.
I better check my whole diet then. I can't, unfortunately, stay in bed all day, or maybe fortunately, but yeah, I know what you mean on that one. We do know the benefits of being physically active. So, positive ways, other ways to improve mental health during these trying times. This is the last day of summer. The sun's going to go down sooner, less daylight. So, what else can we do to keep our mood in check?
Yeah, definitely getting outside in the sun, soaking it up. We need that vitamin D that the sun gives us. Also, doing things that we enjoy. This may be a good time to really take inventory of what are some things that I used to enjoy that I find myself not doing anymore, and figuring out how can I begin to incorporate that in my life and put it
Mm-hmm.
on the schedule. Even if it's one time a week, making a priority to do those things.